This program is brought to you by the Vegetarian Society of Hawaii, a nonprofit organization dedicated to sharing with the community the many benefits of a vegetarian diet. Free monthly meetings include vegetarian experts found locally and on the mainland, quick and easy cooking demonstrations, and healthful and delicious food samples. Members enjoy an informative quarterly newsletter, social activities, and discounts at many vegetarian-friendly restaurants and health food stores. For an application, call 944-8344. That's 944-8344. Or visit our website at www.vsh.org. vsh.org.
Hello, everyone. Thank you for coming out this evening. I apologize for the trouble parking, but see that we're always trying to get you to get more exercise. So that's So without further ado, I'd like to introduce Dr. Mills. He's a graduate of Stanford University School of Medicine. He is also the Associate Director of Preventive Medicine at the Physicians Committee for Responsible Medicine. This is an international nonprofit organization comprised of doctors, laypersons, other medical professionals, promote wellness and preventive medicine, and they're very passionate about that. And we have some of their books, and they have wonderful flyers, and they do a lot of great work. This evening, he's going to present the latest research on the role of diet and nutrition in the treatment and reversal of diabetes. So let's give a very warm welcome to Dr. Mills.
Well, thank you for that wonderful introduction. And as Mary said, tonight we are going to be talking about how to modify our diet and lifestyle to treat and cure diabetes. Now, one question you all probably have is, how effective can this be? Can I really impact my diabetes by changing my diet and lifestyle? And I'd just like to tell you about a patient of mine who made some changes and had a profound effect on her diabetes. This is a woman who, by the time I had started to take care of her, had been diagnosed with diabetes for over 17 years. She was taking about, if I recall correctly, 17 units of insulin in the morning, 70-30, and another 14 at night, plus 10 milligrams of glucotrol XL. So she's on both insulin and oral medicines, and still her blood sugars were running in the mid-200s. So she had very severe disease. She also had severe heart disease. She was on 3 blood pressure medicines, and she told me that she had a number of problems just, with her energy level. She had claudication in her legs. She couldn't walk more than a block without having pain. And I started to talk to her about her diet and how that impacted diabetes, and how if she was willing to make changes, that I was convinced that she would be able to improve the control of her disease. And I have to say that she took the information that I gave her, and by God's grace, she ran with it. She became a complete vegetarian, a vegan vegetarian, and I quickly had to begin taking her off of her blood sugar medicines because her sugars were constantly running low. The upshot is that she has been off all of her diabetic medicines, insulin and pills, for over 8 years. So she is effectively cured of her diabetes. She's come off of 2 out of 3 blood pressure medicines. She lost weight without trying, and whereas before she could barely walk a block without experiencing pain, she started doing volunteer work again and was able during the good weather months to walk a mile to work and from work in the mornings and afternoons. So this is just to let you know that what we're going to talk about tonight is real. The effects can be very, very profound if you're willing to make the changes it takes to get the kinds of results that this other patient had. And I've had other patients who've also incorporated these changes into their life, and they too have had very profound changes in the control and severity of their disease. So with that, I'd like to get started. This is a painting of the rich young ruler. And I start this lecture off because most of us are familiar with the story of the rich young ruler. Christ was out with his disciples in Jerusalem one day, and a very rich young man came up to him and said, "Good master, what must I do to be saved? And Jesus said to him, you need to keep the commandments. You need to love God with all your heart. And the young man said, these things I've done since I was a youth. He said, what else can I do? And Jesus said, one thing more. He said, go, sell everything you have, give the money to the poor, and come and follow me. And unfortunately, the scripture tells us that he went away sorrowful, for he had great possessions. And I think when all of us read that story, you feel a sense of pain, because we realize here he was in the presence of the majesty of heaven, talking to God himself, and he was given the keys to life. But unfortunately, he was so wedded to the things that he already knew that he was unwilling to give them up for something much greater. And I cite that story because the things that I am going to ask you to do tonight, or point out that you should do in order to improve the control of diabetes, may require you to give up things that you've become accustomed to, things that you have become, that you feel that, I can't live without these things. But just like this rich young ruler, if you're willing to make the change, if you're willing to take that leap of faith and give up that which you know for something much better, you too can have great and wonderful changes in your life. First, to talk about what is diabetes, what are the symptoms of it, what are the causes of it, then I think it's easier to understand how to treat it. So, what are some of the symptoms of diabetes? Well, the classic symptoms are frequent urination, excessive thirst, dehydration and fatigue. Oftentimes people have weight loss. They may experience infections that are difficult to control or cure, and or poor wound healing. Well, where do these symptoms come from? Well, let's talk first about the frequent urination. And what you see here is a diagram of a kidney. And the kidney, as you know, is the organ in our body that makes urine. And the fundamental unit in the kidney is this little filtering unit here. Blood passes through here under pressure, and then part of the fluid actually comes off. It gets collected into this capsule here, starts to flow down this tube, and then your body pulls back everything it wants to keep, all of the electrolytes and some of the minerals, and it then dumps in things it doesn't want to keep. And once the fluid passes out here to this collecting tubule, it flows into the bladder, and ultimately it comes out as urine. What is the problem in diabetes? Why do people have excessive urination in diabetes? Well, I like to use this very famous episode from I Love Lucy. If you all remember, Lucy and Ethel one day went to work in a candy factory. And initially, what happened is you have a little conveyor belt here, and these little candies came along, and Lucy and Ethel were to pick them up, wrap them up, and put them down, and that was the job that they had. Well, I want you to think of Lucy and Ethel as the cells lining the tubes in your kidney that normally pull back all of the sugar that gets filtered into that fluid in the collecting duct. And if you only have a small or normal amount of sugar, represented by the candy, coming down that tubule, you're able to pull it back with no problem, and you don't get a problem with the sugar spilling into the urine. But as this slide points out, there are only a limited number of these cells lining your tubule. So if the amount of sugar flowing into the filtrate is too high, what ends up happening is that you start getting too much sugar coming down the pike, and the cells are not able to retrieve all of it, and as a result, the sugar starts to spill into the urine. So diabetes actually means sweet urine. And I'm so glad we have new diagnostic tests, because in the early days of medicine, doctors diagnosed diabetes by actually tasting urine. Well, what happens? Why is it that when sugar starts to spill in the urine, you start to get excessive urination? Well, most of us have made strawberry shortcake at one time or another, or seen someone make it. And the first thing you do is you cut up your strawberries, and then you pour sugar over it, and you let it sit. And what happens is, over time, the sugar pulls fluid out of the strawberries. That's because sugar has what's called osmotic force. That is, it can actually pull water along with it, and something very similar happens in your kidney. When sugar starts to spill over into the urine, that sugar pulls fluid with it, and that's what causes you to have excessive urination, and because you're urinating all the time, you become dehydrated and you're thirsty all the time, and those lead to the classic symptoms of diabetes. The other problem with sugar is that sugar is a fuel. And like all fuels, you need to keep the level within certain limits so that you don't run into problems with damage related to having too high sugar levels. So sugar is a reactive molecule that readily binds to proteins and fats in your body. Therefore, your body wants to keep your sugar level within a very narrow limit. It doesn't want it to go too low because, again, if your blood sugar is too low, the brain can't function properly since it only uses sugar for its energy metabolism. But by the same token, it doesn't want your blood sugar level to go too high because then you can begin to have damage to a number of different organs. Insulin is a hormone made by special cells in an organ called the pancreas, and the pancreas senses the level of sugar in our bodies or in our bloodstream and releases insulin into the bloodstream to help keep the blood sugar level within a normal range. When insulin is released, it stimulates cells in the body to take up sugar from the bloodstream so that the blood sugar level stays within a very narrow range. Normally, the amount of insulin released is in direct proportion to the rise in blood sugar, but chronically elevated insulin levels can increase disease risk through a number of different mechanisms that we'll talk about a little later. Also, if your insulin levels are constantly high, it tends to prevent your body from burning fat. And that's important because that can also lead to some of the other problems that we see with diabetes. And that also is the reason that people recommend a low-carb diet. The Atkins people suggest that by eliminating carbohydrates from your diet, that it will help lower your insulin levels and help you burn more fat. Because, as I said, if your insulin levels are too high, it prevents your body from burning fat. However, the Atkins diet is not the way to achieve that goal. The Atkins low-carb fat diets are very, very unhealthy diets because they promote a starvation-like physiology in your body, which leads to a number of other problems down the line. It is possible to keep your insulin levels within normal limits by staying away from what are called processed carbohydrates and using more whole foods and whole grains. And we'll talk about that more later on in this talk. Well, there are two types of diabetes. There's what's called type 1. It used to be called juvenile onset diabetes, and typically that was the kind of diabetes that we saw in children. And this is an autoimmune disorder that is caused by a complete absence of insulin. And what happens is the body's immune system, it kind of goes haywire and attacks the insulin-producing cells in that organ called the pancreas, and it destroys those cells. And when that happens, then the children aren't able to produce insulin, and their metabolism goes it goes out of control. Now, as I said, this typically affects children, and studies have shown that early exposure to cow's milk actually increases the risk of developing type 1 diabetes. So the American Academy of Pediatrics actually recommends to new parents that they not expose their children to cow's milk until they are more than 1 year old. And the reason is that children less than a year old don't have a complete set of protein digesting enzymes. And there's a reason for that. The reason is that they should be able to absorb antibodies from their mother's milk so that they will have what's called passive immunity to a number of different potential disease-causing organisms. If they had all of the protein-digesting enzymes that adults have, they would break down their mother's antibodies and they wouldn't be able to absorb them intact. But by having an incomplete set, they have, I think, 3 out of the 5 enzymes, they're able to absorb their mother's antibodies intact, and that's what helps protect them from getting a number of diseases. The problem is that because they don't have a complete set of protein-digesting enzymes, there's a protein in cow's milk called bovine serum albumin, BSA, that gets broken up into large fragments that gets absorbed into the baby's body and can stimulate the baby's immune system to make antibodies against those BSA proteins. Now, the problem with that is that those antibodies against those BSA protein fragments can then, under certain circumstances, attack the beta cells or insulin-producing cells in the pancreas, and that's what can lead to type 1 diabetes. So it is, for those reasons, it is recommended that we not give children cow's milk until they are more than a year old, and by that point they have all of their protein-digesting enzymes, and they're able to break down that BSA protein completely, and it's a much lower risk for developing the type 1 diabetes. Now, type 1 diabetes is not the most common type of diabetes. The most common type of diabetes is what's called type 2 diabetes. Again, it's sometimes referred to as adult onset diabetes. This, as opposed to being characterized by an absence of insulin, the problem is not that you don't make insulin, it's that your body doesn't respond to insulin in a normal fashion. And that's called insulin resistance. One way to think about this is I tell my patients, it's like your body has become partially deaf to insulin. And you know, if you don't hear well, or if you know someone who doesn't hear well, what you have to do is you have to speak louder to try and get them to hear you, or you have to give them a hearing aid, or both. Well, when people develop type 2 diabetes, their body becomes insulin resistant, and it does not respond to the insulin that their pancreas produces in a normal fashion. Now, before I go any further, is that clear to everybody? Are there any questions at this point? Because I want to make sure that everybody's with me and you understand the points that I'm trying to make. Any questions so far? Yes, sir. The gentleman's making the point that he's concerned that what I might have been suggesting was that that there was nothing wrong with feeding children milk after they're a year old. I'm glad you brought up that point, because that helps me clarify something. I am not saying that you should feed milk to children once they're a year old. Quite frankly, I think that it's best if you don't feed children cow's milk. But if a person is inclined to do that, they absolutely should not do it before the child is at least a year old. But even for children older than a year, there are many reasons why it would be beneficial to avoid cow's milk and to use other types of milk for cereal and other nutritional needs. There are a number of problems associated with dairy foods, but so that's a very good point, and I agree with you there. But the only point that I was trying to make is that to lower the risk of diabetes, children absolutely should not be exposed to cow's milk before they're a year old. But there's very good cause to not expose them to it even after that point. So your point is very well taken. Any other questions? The question was, with insulin resistance, is it a problem with the pancreas or is it a problem with the cells in the body? The problem is with the cells in the body, that the cells in the body do not respond to insulin in a normal fashion. So instead of responding to insulin, say, 100% of a normal response, they may only respond 60 or 70%. And so what that means is that the body has to try and dump out more insulin in order to get the blood sugar level down. And what happens over time, and again, we'll go through this as we move through the lecture, is that the insulin levels tend to go higher and higher in an effort to keep the blood sugar level down, and ultimately you reach a point where the pancreas cannot produce enough insulin to keep the blood sugar level within a normal range, and then the blood sugar level rises and you have what's considered frank diabetes. So this gentleman and then the lady in the back. Yes?
You mentioned hydrogenated oil. Now, at the turn of the century, they weren't around yet.
Right.
Nor was diabetes?
Actually, I haven't mentioned hydrogenated oils just yet, but that's actually a good point. I was going to touch on that a little later on. But this gentleman is making the point that hydrogenated oils, which are an artificial type of fat that is made by the food industry, has been linked to increasing the risk for developing insulin resistance and type 2 diabetes. And that's a very good point. Yes, ma'am. Okay, the question is, well, what about organic milk? Is that better than the regular milk that you buy in the store? Only in the sense that you may not be getting the hormones and other things that they use to raise standard dairy cows. But the fundamental problem with milk is that milk was designed by God, or if you don't believe in God, nature, to feed baby cows, not human beings. And it is not the best food for human beings, in that cow's milk is very high in protein. There's evidence that the proteins in cow's milk promote cancer development in humans, particularly prostate cancer, ovarian cancer, and possibly other types of cancer. And furthermore, it's very, very high in fat, again, which is not healthy for our hearts. It's very high in saturated fat. I mean, you all know that butter comes from milk. Butter is milk fat. Again, baby cows are about 80 pounds at birth, and by their first birthday, they tend to, if they grow normally and are fed normally, they'll weigh close to 1,000 pounds. So milk is designed to promote rapid growth in these animals. And unfortunately, when it's taken into our bodies, it can stimulate abnormal growth in cancer cells and cause other problems. So, while the organic foods are better in terms of possible pesticide exposure and or abnormal hormone exposure, they're still problematic in that you're talking about a food that isn't necessarily a very healthy food for human beings to consume. So let's talk a little bit more about insulin resistance, because I want to make sure everybody understands what the problem is. As I said, insulin resistance is the tendency of cells to incompletely respond to insulin. In effect, the cells will become partially deaf to insulin. When insulin resistance develops, the pancreas must secrete higher levels of insulin to try and control our blood sugar. And when it's severe, the pancreas cannot secrete enough insulin to keep the blood sugar in the normal range, and then you have frank diabetes. Well, what are some of the things that increase insulin resistance? Now, as you can see here, this is a little cartoon of some people who unfortunately are not in a very fun place, and one of them has ordered a pizza, and the caption reads, well, first of all, this is going straight back, and I'll just have a little chat with whoever ordered the pizza. And by the way, I try to include cartoons in here because I want a little humor, so even if you don't think it's funny, just laugh to make me feel better. Okay, so you can probably tell from where I'm going with this that one of the things that can increase insulin resistance are diets that are high in the stuff that you find in pizza, which is cheese, which is high in fat, the crust, which tends to be processed, carbohydrates, and these are some of the things that increase insulin resistance. Well, other factors that increase insulin resistance are being overweight or obese. Carrying around significant amounts of excess body weight promotes insulin resistance and tends to make the body not respond properly to insulin. A lack of regular exercise, being a couch potato, being sedentary, again, increases insulin resistance. Diets that are high in fat. High levels of fat in the body actually interfere with the action of insulin in the body so that it does not give its normal response. Diets that are high in processed or simple carbohydrates. By processed carbohydrates, I mean carbohydrates that have had their fiber removed. So, for instance, I'm talking about white flour as opposed to whole grain flour, white rice as opposed to brown rice or wild rice. And by simple sugars, I mean or simple carbohydrates, I mean processed sugars. So that would be like soda, high fructose corn syrup, etc. Diets that are high in animal protein also increase insulin resistance. diets that are low in fiber increase insulin resistance, and also having excess levels of iron in the body can promote insulin resistance, and obviously having a genetic predisposition. Now, let me touch on this issue of the genetic predisposition because, again, I've got patients who come in and they say, Doc, my sister has diabetes or my mother has diabetes. Does that mean I am going to get diabetes? Or they may have a very strong family history. It could be the grandmother, the parents, and maybe some of the siblings already have been diagnosed with it, and people wonder, well, if everybody in my family seems to have it, does that mean I am going to get diabetes? And the answer is not necessarily. That yes, when you have a genetic predisposition to diabetes, that does place you at higher risk of developing it, but that does not mean you are going to develop it if you do the things that can help prevent your body from developing this severe insulin resistance that leads to diabetes. Is that clear to everyone? Now, let me give you a different way of conceptualizing this. Having lungs means that you are genetically predisposed to drowning, but only if you get in the water. Okay? So, again, having a genetic predisposition to diabetes does place you at risk for it, but only if you do those behaviors that tend to promote diabetes. Okay? All right. I want to be clear with everyone. All right. Well, let's talk about the damage that diabetes causes, because we know that once a person is diagnosed with diabetes, they are at risk for developing a number of different health problems. People with diabetes frequently develop problems with their retinas. That can lead to blindness, problems with the kidneys that can lead to kidney failure, circulation problems in the lower extremities that can ultimately result in incurable infections that lead to limb amputations, and accelerated development of heart disease. Well, why is that? How is it that one disease can cause problems in so many different organ systems? Well, it is because of a process I refer to as caramelization. What is caramelization? Well, it turns out, I have to smile about this because I don't eat this very often, but my favorite cake is pineapple upside down cake. And watching my mother make pineapple upside down cake, the first thing she does is she makes that caramel that kind of goes on top of the cake. And what does she do? She melts some butter or margarine in a pan. She puts in some sugar, stirs it over heat, and ultimately she ends up with this caramel that she puts the pineapple in, and so on and so forth. Well, how does that relate to diabetes? Well, animal cells, every cell in our body has a membrane made up of fatty molecules. Cell membranes are made up of fatty molecules, and sticking out of these membranes are all sorts of proteins. And as you know, your body is about 100 degrees Fahrenheit, normally 98.6 degrees, roughly 100 degrees. So what happens is that over time, if your blood sugar level is too high, you can end up getting this process very much like caramelization happening in your blood vessels and on the cells in your body. Sugar molecules end up being attached to the cell membranes, and that can cause a number of problems. When you get this caramelization type process occurring in the heart, you get accelerated blockages in the vessels supplying blood to the heart, which leads to heart disease. In the kidneys, it leads to kidney failure, retina, and so on and so forth. So that's the problem. When your blood sugar level goes too high, you get this process of that's analogous to caramelization occurring on your cells that ultimately can block blood vessels, cause nerve dysfunction, and a number of other problems. Well, how do you treat this? How do you bring this under control? Well, as I always tell my patients, you cannot repair fire damage until you put out a fire. Because a lot of times patients will come in and they'll say, well, doc, I have a problem with my kidneys, or I have a problem with neuropathy in my legs, and I want to try and get this problem under control. But in the meantime, their blood sugar level is still poorly controlled. And the first thing we have to do is we have to get that blood sugar level under control before we can try and start repairing the damage that's been done by the diabetes. And again, if you can't read this caption, it says crisis clinic. The crisis clinic is on fire, in a river, and about to go over a waterfall. All right. Well, let's talk about some of the medications that we use to treat diabetes. There are what are called oral hypoglycemic. That is medicines, pills that you take that can help lower blood sugar. How do they work? They work by stimulating the pancreas to release excess amounts of insulin. And that, in effect, helps bring your blood sugar level down. Now, I have this little picture here of a woman speaking through a trumpet, and the idea that I want you to get is that is analogous to shouting louder for someone who's partially deaf. Okay? So if someone is partially deaf, one of the ways of getting them to hear you is by speaking louder. Well, stimulating your pancreas to release extra levels of insulin is equivalent to speaking at a higher volume. The oral medicines tend to be ineffective when insulin resistance becomes extremely severe. And at that point, then, people require injected insulin, and you start to have to give yourself insulin shots. And again, what that does is it increases the level of insulin in your body, and that does help bring your blood sugar level down. But part of the problem is that, as I said before, high levels of insulin can promote disease in and of itself. So there are other things that we want to do to try and treat diabetes. Other medications that are used are glucophage or metformin. And one of the ways that helps control your blood sugar is by slowing the production of glucose, which is a sugar in the blood, by the liver. There's a medication called Precose that you take along with your meal that acts like dietary fiber and actually slows the breakdown and absorption of the food that you eat. And then there are drugs that increase insulin sensitivity. Insulin sensitivity is an index or a measure of how well cells respond to insulin, and in effect, it is the opposite of insulin resistance. And again, we have this young lady speaking to this gentleman through an ear trumpet, which is analogous to using like a hearing aid to make the ear more sensitive to sound. So if you can make someone who's partially deaf more sensitive to sound, then you don't need to speak as loudly. Does that make sense to everyone? So again, by increasing insulin sensitivity, then you won't need as much insulin in your system to help control your blood sugar. And that's the ultimate goal of all diabetic treatment, is to try and improve the body's insulin sensitivity so that you can get those insulin levels down, hopefully stop using as much medicines or any medicines, and manage your diabetes either through diet alone or with a minimum of medicines. Well, what are some factors that increase insulin sensitivity? Losing weight. Getting rid of excess body weight helps improve insulin sensitivity. Regular exercise is one of the #1 factors that help improve insulin sensitivity. So basically, getting up off the couch and moving. And by regular exercise, do I mean you have to go out and run a marathon every other week? No. What studies have shown is that if you you go out for a walk at least 45 minutes at a time for a minimum of 3 to 4 times a week on a regular basis, that will significantly improve your insulin sensitivity. Now, of course, if you do more, that's even better. But you should not feel that you have to go out and, run 5 miles or work out at the gym 6 or 7 hours a day. It's not necessary to do that, but you do want to get at least 45 minutes of continuous exercise, a minimum of 3 to 4 times a week on a regular basis. That will significantly improve insulin sensitivity. It will also help you lose weight, which will additionally improve insulin sensitivity. decreasing the amount of fat that you eat in your diet will have a tremendous impact on improving insulin sensitivity. I had a patient in my clinic who, this was a gentleman who was only Spanish speaking, and when I first took over his case, I was looking back through his chart, and what I noticed was that his diabetes was just terrible. I mean, he was routinely running blood sugars of over 300. And he was on all kinds of medicine, insulin plus pills. And what I noticed in his chart was that some of the doctors who had seen him previously would put things in the little notes in the chart saying this patient was non-compliant. And that's just a fancy word for saying that he's not doing what he should do. But that didn't make sense to me because he kept every single appointment he was ever given. Now, people who usually don't pay attention to their doctors usually don't keep their appointments very well. So it led me to think that maybe the problem wasn't the fact that he was non-compliant. Maybe it was simply that he didn't understand what we wanted him to do. And again, as I went back through the chart, I noticed that he would come to clinic and we wouldn't have an interpreter there. So we would just kind of shove medicines at him. He would take his medicines. He would dutifully take them as prescribed and come back, but he wasn't getting any better. Well, I insisted that we get an interpreter for his next clinic appointment, and it turned out that this gentleman was a truck driver, and he was eating in greasy spoon joints. So his diet was just loaded with greasy, fried, high-fat foods. I took some time and explained to him the importance of eliminating the fat from his diet, because of the fact that interfered with the effect of insulin. And to make a long story short, when he came back to clinic, he brought his little glucometer with him so that I could look back and see what his blood sugars has been, and his blood sugars had dropped by over 150 points by him eliminating the greasy, high-fat food from his diet. So a tremendous impact on improving insulin sensitivity. Now, one of my patients, and this is another patient that I talked to about eliminating the fat from his diet, told me, well, you know, Doc, I eat a lot of pasta. I love macaroni and cheese. Well, I had to break the news to him that, excuse me, macaroni and cheese is not a low-fat food. And he said, oh, that's okay, Doc. I put a little vinegar on it, and that cuts the fat. No, it doesn't. It just gives you vinegar-flavored fat. And, you know, again, I explained to him that, no, the cheese, just so you know, cheddar cheese is 65% fat, and 75% of that fat is saturated fat, the worst kind you can possibly eat. So, no, macaroni and cheese is not a low-fat food, and we needed to eliminate that from his diet. So you also wanted, the other problem with macaroni and cheese is it's full of white pasta, which has absolutely no fiber. Is made from white flour, which is a high glycemic index food. How many of you have heard the term glycemic index? Okay, how many people know what that means? Okay. All right, well, let's talk about what is the glycemic index? Well, the glycemic index is a measure of how any food will affect your blood sugar level. And how do we figure that out? Well, what we do is we take some volunteers like this gentleman here, we bring him into our clinic, and we feed him 100 grams of sugar. And we take his blood sugar level at time 0 when he first takes the sugar. We take it a half an hour later, an hour later, an hour and a half later, and then 2 hours later. And we measure how rapidly his blood sugar level comes up and comes down. And from doing that, we get this, what's called a bell-shaped curve. Everybody with me? Well, then what we can do is we can take other foods, like we can take an equivalent amount of, say, white rice versus brown rice, white bread versus whole wheat bread, and take the same measurements, and we watch and see how closely the rise and fall in blood sugar parallels that of eating pure sugar, and that's what gives us the glycemic index of a food. So if a food causes your blood sugar level to rise very, very high very quickly, that is a food that is said to have a high glycemic index. If, on the other hand, the blood sugar level has a much more gradual rise and doesn't peak very high but tends to stay low, over time, that food is said to have a low glycemic index. And again, for anyone, well, for everyone, but particularly for people who are dealing with diabetes or have loved ones who are dealing with diabetes, you really want to make sure that you stay away from foods that have high glycemic indexes. What are some high glycemic index foods? Foods that are highly processed. Again, white flour, white rice, plain pasta, white potatoes that are eaten by themselves, French fries, things like this. These are all foods that have a very high glycemic index and will tend to both make your blood sugar level go out of control and also increase insulin resistance. By staying away from processed carbohydrates and eating whole grains and whole foods, these are foods that have a low glycemic index or lower glycemic index, and they will help improve insulin sensitivity. Now, so, I think you guys are probably starting to get a theme here, that real whole plant foods, foods that have not been processed, that have not been modified so that they've had their fiber removed or turned into crackers and cookies and things like that. You stay away from those foods and eat whole foods, beans, legumes, whole grains. These types of foods help improve insulin sensitivity and reduce the risk or severity of diabetes. Switching to a vegetarian and or particularly a vegan, that is a diet that contains no animal foods, tremendously improves insulin sensitivity. PCRM, the Physicians Committee for Responsible Medicine, the group that I work with, is currently doing a study that is showing exactly that. We've taken people with diabetes who've been diabetics for a number of years, put them on a vegan diet, and we've shown that for most of these patients, we can either get them off of their medicines completely or reduce the amount of medicines that they need significantly because they get such dramatic improvements in their insulin sensitivity. And then there are some herbs and medications that also increase insulin sensitivity. All right, well, let's talk a little bit about carbohydrates, because the question is, are carbohydrates bad? Well, no, but some of them are. It's just like people. Are people bad? No, but some of us we have issues. So it's the same with carbohydrates. All carbohydrates are not bad. Only those carbohydrates that have had their fiber removed or have been so processed that they have a high glycemic index are the bad carbohydrates. So there are terms that we often use when talking about carbohydrates. We talk about simple carbohydrates versus complex carbohydrates. What is a simple carbohydrate? Things like refined sugar, or things that have refined sugar in them. Candy, soft drinks, highly processed juices. Complex carbohydrates are starches, and they would be found in your grains, breads, legumes, etc. Now, sugars come in two different forms. You have what are called monosaccharides, which are single sugars, such as glucose, fructose, and dextrose. And dextrose and glucose are the same thing. And this is glucose, this is fructose. Or you have your disaccharides, which is a double sugar, di meaning two, such as sucrose, which is table sugar, and that's two sugar molecules joined together. Other disaccharides that are common in the diet are lactose, which is found in milk, and maltose. And let me just take a moment to say lactose, which is the sugar found in milk, presents a problem for a lot of people once they become adults. For instance, I am extremely lactose intolerant, meaning that I cannot digest lactose because our bodies do not absorb disaccharides. We don't absorb these double sugars. In order to absorb sucrose table sugar, you have to split these two sugars in two, and you absorb them as individual sugars. Well, lactose, as I said, is a disaccharide. The enzyme that splits lactose is called lactase, and infants have lactase, but in the majority of the people in the world, once they become adults, their body stops making the enzyme lactase, and so you can no longer split this lactose into the two sugars, which means you can't absorb it. And what did I say happens when you have a sugar that doesn't get absorbed? It starts to pull fluid with it? Well, when this lactose, which is a double sugar, if it's not absorbed, it passes into the large intestine, and then it begins to pull fluid into the large intestine, and you start to have diarrhea, one of the principal symptoms of lactose intolerance. The other problem is that the bacteria in the large intestine, they don't have a problem digesting this lactose, and so they begin to break it down and produce lots of gas, and that's what gives people the bloating and cramping that's associated with lactose intolerance. All right, starches are simply long chains of sugar molecules linked together. All starch is eventually broken down into single sugars. Now, processed carbohydrates are those carbohydrates, that's what the CHO stands for, that have had their fiber removed. And like my friend Godzilla here rampaging through downtown Tokyo, diets high in processed carbohydrates wreak havoc on our health. Processed carbohydrates tend to have a high glycemic index, and that leads to elevated insulin levels and elevated insulin resistance. All refined sugars are processed carbohydrates. That includes fructose, sucrose, and even honey. Refined sugar can be very, very addictive, and as the slide points out, large amounts of refined sugar increase insulin resistance. Now, starches can be processed or unprocessed. Over here you see this is plain white pastas, whereas down here you see, which tend to be made from processed white flour. On the other hand, you can have whole grains, and you can have bread that are made from whole grains, which have the fiber in them. Unprocessed starches, whole natural foods, such as whole grains, brown rice, whole wheat, etc., do not have a high glycemic index and do not increase insulin resistance. Now, I just like to make the point here that plants have no bones. Therefore, they use fiber to help stiffen and protect their tissues and resist the force of gravity. And so every plant cell is surrounded by a fibrous cell wall. And so unprocessed carbohydrates are those plant tissues or plant products that still have their fiber in them. And that this fiber has been shown to slow down the breakdown of the starch and help give these foods a low glycemic index. Does that make sense to everyone? When you have fiber in the food, that slows the breakdown and absorption of the starch so that you don't get those high spikes that I talked about before, and that's why these foods have a low glycemic index and they're much healthier for you. The other advantage of foods that have a lot of fiber in them is that you end up feeling full much sooner, even though you've eaten fewer calories, and that sensation of being full and being satisfied stays with you longer because that fiber passes all the way through your digestive tract without being absorbed, so it helps you feel full and you don't get hungry as fast, and as a result you eat fewer calories and it's easier to maintain your body weight. And the other advantage is that it helps with problems like constipation, diverticulosis, hemorrhoids, and so forth. In addition, fiber reduces the risk for things like colon cancer, breast cancer, prostate cancer, and other problems. So, what are some types and sources of fiber? And I put this slide here because we've all seen that commercial that I absolutely despise, where the woman says, "I get my fiber in 2 caplets." No, you don't. Because there's more than one kind of fiber. There are a number of different types of fiber, and they're all found in whole plant foods. And so you can see from this list here that this list is called water-soluble fiber, or this chart shows you water-soluble fibers, and they're what are called gums, and they're in pectins. Your gums are found in like oatmeal, oat products, dried beans, and other legumes. The pectins are found in fruits and vegetables such as squash and cabbage and dried peas. A partial list of the benefits: they decrease blood cholesterol and also delay glucose absorption and the emptying of the stomach, which helps improve blood sugar control, protects against heart disease and diabetes. Now, has everybody here had some okra? You know, okra has that kind of slimy character. That sliminess that you find in okra and even in oatmeal, that's water-soluble fiber, and it's very, very good for you. Well, in addition to the water-soluble fibers, there are water-insoluble. This list is the water-insoluble fibers. Those are fibers that do not dissolve in water. And these are your celluloses and hemicelluloses. And that's the classic bran fiber that's found in like whole wheat. And again, you find it in a number of plant foods. And then you have other types of bran or celluloses called hemicelluloses. And these are found in whole grains, Brussels sprouts, green leafy vegetables like mustard greens, kale, and spinach and so forth. And oat bran. Oat bran. Bran would be the insoluble fiber. Yes, absolutely. Yeah. Oat bran falls into both categories. So as I said, this is only a partial list. The bottom line is that all whole plant foods are loaded with a number of different types of fiber that exert beneficial effects on our health. And again, part of the mechanism is that they absorb water, increase stool volume and transit time so that you're very regular. You tend not to have a problem with constipation. It also protects against colon cancer, diverticulosis, hemorrhoids, and some of the other problems that I talked about. Yes, sir. What the gentleman is pointing out, he said that cabbage kind of made both lists. Actually, a number of these vegetables make both lists, and that's because whole fresh plant foods have all different types of fiber. And that's the whole point, that there are many types of fiber that are found in a variety of different plant foods, and to have optimal health, you want all of those types of fiber, not just that stuff that they give you in a capsule or in a Citracel or whatever else they're trying to, get you to spend your money on. He said, well, what's under control? How do you define that? I would like to see your blood sugars, if you're diabetic, consistently less than, I would say, 130. But there's a better index of how... See, the reason I said less than 130 is because I have to include both after meals as well as fasting levels. But there's a better index of control, and that is something called the hemoglobin A1C, or glycosylated hemoglobin. How many people have heard of that term? Okay. Well, let me explain what that is. The hemoglobin A1C, or glycosylated hemoglobin, gives you a picture of how well your blood sugar has been controlled over the previous 3 to 4 months. Well, how can that be? Well, it turns out that red blood cells, the oxygen-carrying cells in your bloodstream, live for an average of 3 to 4 months, 90 to 120 days. And remember I said that sugar is a reactive molecule. It will tend to attach itself to cell membranes and so forth. Well, what we've discovered over the years is that if a person's blood sugar level is within a normal range, there will be a very small percentage of red blood cells that have these little sugar molecules attached to them. So we can draw some blood from you, look and see what percentage of your red blood cells have these sugar molecules attached, and that will tell us how well your blood sugar level has been controlled. As the blood sugar level goes higher and higher and stays higher, a larger and larger percentage of red blood cells end up with these little sugar molecules attached to them. And so what studies have shown us is that for a person who's been diagnosed with diabetes, you want your hemoglobin A1C to be less than 7. What's the magic number? 7. Because diabetics whose hemoglobin A1C is less than 7 have a very low risk of having the complications associated with diabetes, such as heart trouble, retinal damage, kidney problems, and so forth. But as the A1C goes above 7, the risk of developing those long-term complications rises. So in general, you want to get that hemoglobin A1C down less than 7. And as I said, you want to make sure that your blood sugar level is less than 130 even after you eat a meal. Okay, that's good control. All right. And also, you want to be sure you're taking a multivitamin every day because that'll help with energy level and also help improve blood sugar level or blood sugar control. People ask me, what vitamin do you like? Personally, I take Centrum. That's what I recommend to my mom. That's what I'd recommend to you all. You know, sometimes we say one thing and people hear something else, and that's kind of illustrated by this slide. Guy in the water says, Lassie gets help, Lassie goes for some psychiatric assistance. So I'll open the floor up to questions now. Thank you very much. The problem with diabetes for most adults is insulin resistance, and that's caused by a number of things that are very common to our lifestyle. Eating a diet that has a lot of fat, a lot of animal foods, a lot of processed carbohydrates, and not getting enough exercise. And that the primary way you want to treat that is by doing the opposite. Eliminating the fat, the animal protein, the processed carbohydrates from your diet, switching to a whole foods, plant-based diet, and getting regular exercise. And as I told you with my other patients, you will see profound improvements in your diabetes, and that is the way to go. Even when it comes to using these supplements, I don't want you to get the idea of, oh, all I have to do is start popping a bunch of herbs and supplements. No, you want to change your diet and lifestyle so that you can correct the underlying problem that promotes diabetes. Yes, ma'am. Caffeine. Caffeine, no, that's actually a good question. Caffeine actually is a stimulant that's found in coffee and has been shown to cause a number of problems. It can promote calcium loss, it can promote heart arrhythmias, and it may even interfere with blood sugar control. So I would urge you to try and use non-caffeinated beverages as much as possible. Yes, in the back. The question was, are there studies that actually show an increased risk or an increased prevalence of type 1 diabetes in children who've been exposed to cow's milk? And the answer is absolutely. The studies show conclusively that when children are exposed to cow's milk before they're a year old, are at much higher risk of developing diabetes. I can't tell you the exact numbers, but if you go online, you should be able to pull that information up. And as I said, this is so well established that the American Academy of Pediatrics strongly urges parents not to feed their children cow's milk until they're more than a year old. But as this gentleman pointed out over here, there are good reasons to avoid it altogether. And there really is no reason to feed children cow's milk because there are a number of other beverages that can be used. There's rice milk, soy milk, calcium-fortified juices. So we shouldn't feel that we need to feed children dairy foods. They're absolutely not necessary. I'll be happy to stay behind and answer any questions for anyone who has any other questions, okay? All right, and again, thank you very much for coming.
This program is brought to you by the Vegetarian Society of Hawaii, a nonprofit organization dedicated to sharing with the community the many benefits of a vegetarian diet. Free monthly meetings include vegetarian experts found locally and on the mainland, quick and easy cooking demonstrations, and healthful and delicious food samples. Members enjoy an informative quarterly newsletter, social activities, and discounts at many vegetarian-friendly restaurants and health food stores. For an application, call 944-8344. That's 944-8344. Or visit our website at www.vsh.org. vsh.org.